So today we're going to be talking about mobility and ambulation techniques. My name is Ariana Gutron. Some of you may have attended other trainings with me. Um, so it's a pleasure for you to be here today. Thank you for taking the time again. I've been working for San Isidro Pace for the past 3.5 years. I am a certified nurse assistant as well as a medical assistant, and most of my work at PACE was in the physical and occupational therapy department. So today we're gonna be talking about mobility and ambulation, and this is to promote independence for our seniors as caretakers and of somebody taking care of a family, a loved one. Um, these are really good trainings, and especially this one, mobility and ambulation, in order to help those that you take care of, keeping and promoting their independence. So an overview of what we're going to talk about today is the importance of maintaining mobility, common mobility challenges, benefits of improving mobility, assessing mobility, enhancing mobility, gait and proper walking techniques, assistive devices, home modifications that we can do for mobility, the importance of nutrition and hydration, community support, caregiver support, and then we conclude. So maintaining mobility and the ability to ambulate independently are crucial for the well-being and quality of life of elderly individuals. In this presentation, we're gonna going to explore the importance of mobility, common challenges faced by the elderly, and the strategies to support their ambulation and independence. So the importance of maintaining mobility. Maintaining mobility is crucial for the elderly to perform their daily tasks independently, fostering a sense of control and dignity in their lives. We all know how important it is for seniors to keep some level of independence in order for keeping them with a good mental health. So this promotes independence and quality of life because mobility allows the elderly to do activities and stay active, maintain their independence. It also helps them with the physical and mental health, as regular movement and ambulation improves cardiovascular health. Gives them the strength, the flexibility, while also reducing risk of falls and cognitive decline. So it is very important to keep them mobile. It also helps with social engagement, the ability to move freely, and enables the elderly to participate in social activities and stay connected with their community, and this avoid the isolation and loneliness as they want to be taking part of different activities and feel more comfortable, not being dependent on other people doing some stuff. And it also prevents complications as mobility helps to maintain uh, health in good conditions and avoid secondary health issues such as pressure sores, contractures, and respiratory complications, which can just worsen and arise from prolonged inactivity. So it is very important to keep mobility going for our adults, um, because these are some of the important things that this helped. But it's not that easy. A lot of our elderly population faces different challenges with their mobility. And this is because decreased muscle strength and flexibility as part of the aging and certain medical conditions that challenge the mobility. There are chronic health conditions that may have, such as diabetes, cardiovascular, some vision and hearing problems, the fear of falling, environmental barriers, and cognitive declines. These are challenges that people find every day and challenge the mobility or the capability to keep moving. But what are the benefits of improving mobility and ambulation? It enhances mobility, and the enhancement of mobility and ambulation in older adults can yield profound benefits in enabling them to maintain independence, as I keep saying. But it also reduces the risk for falls and engage in activity of lifestyle. Improved mobility also preserve, as we mentioned, the health, the physical function, and also mental health. So all this together just means overall quality of life, which is what we're looking for in our elderly population. Uh, f- but it is also important to know what the limitations are, the capabilities of these people that these people have, and this is why it is important to assess their mobility and their balance capabilities and an accurate evaluation, it is crucial because then a specific program or intervention can be designed for them depending on what they can do. This involves a comprehensive assessment of factors like gait, their strength, their flexibility, their coordination, their sensory function, and there is the existence of a standardized tests and measures such as the timed app and go, which is called is also known clinically as the TOG test, or the Berg Balance Scale. And this provide a valuable insight into individuals' functional abilities and fall risk. Um, so these are just tests that are used to assess the levels of mobility or a person's to do, how easy this is. And working in the therapy department for some time, I saw the doctors of physical therapy doing this test on our patients on daily basis to see what they were able to do, how much they could do, and based on that, the doctor of physical therapy would determine um, what kind of exercises maybe would work for them, what were the areas that they needed to work on to keep them mobile and independent. So this is why assessing them is very important. Enhancing mobility. How can we enhance mobility? There are resistance exercises, and these are exercises that will help strength training with weights, resistance bands, or body weight exercises. And this helps seniors to build muscle and also improve overall mobility by enhancing stability, balance, and functional movement. So that's why after assessing and determining what could work for somebody, there would pretty much make a plan for them. So for some people, resistance exercise work. And for other people, lower body strength. There's people that need, more work on their lower body parts, like legs. And this is by targeting the major muscle groups of the legs, hips, and core. And this is crucial for developing a strength and power need for safe and efficient ambulation. But also there is upper body strength, and this is strengthening the arms, shoulders, and back muscle support proper posture, balance, and the ability to use assistive devices like walkers, canes effectively. So there would be programs that are targeting Those muscles on the arms and upper body muscles that will help them to make use of devices for walking, such as canes and walkers, properly, because they can also be weak and they could, potentially have an accident if they don't have enough strength to push or lift up a little bit those devices. And the personalized programs, older adults should work with qualified professionals such as therapists to design customized strength training routines that will address their individual needs, limitations, and fitness goals because everybody will have different needs, will have to work in different areas. And these personalized programs are specifically for individual use that will benefit more. So it is important to know the gait and proper walking techniques, like posture. It is important to maintain a good posture for efficient and safe walking. Many of you might have seen that a lot of seniors or the people in the elderly population tend to walk bending down and like in the first picture that you can see in the graphic, they are bending, the chain is too far away from them, so the proper way to walk is standing tall with their shoulders back, chin tucked, and core engaged to support their spine and reduce the strain. Uh, you can always correct them. Would be around San Isidro Pace Center, seeing how some people walk, and I would actually go and correct them. It's not like you have to call them out, but just show them, and they will see that different is easier to walk. And this is a proper posture, because keeping an the wrong posture while walking would just have other side effects like making back pain worse, hip pain worse, or even legs and knees pain worse. So keeping a proper posture will help. The proper another technique is a heel to toe motion, and this is an encouraging smooth heel to toe motion that will help develop a stable and balanced gait. And this technique promotes better weight distribution and reduces the risk of trips and falls. It is very important to make complete use of the foot touching, starting with the heel. And as you take the next step, you go into the toes to push up, and this will help maintaining good balance, and it distributes the weight through the body. It is also important to strive length, and finding the optimal stride length is crucial. Seniors should take steps that are comfortable and natural, and neither too short or too long to maintain a smooth and controlled pace, and also prevent from falls. You might have seen also seniors walking with a walker around, and they give tiny little steps, and this is unsafe because they're not giving their body the proper balance in case of stumbling up on something to help them, stand stall, and it will just be a easier way for them to fall. So not too long and not too short, and it is just, smooth. An arm swing is very important as well. Our whole body when walking has to be working properly. So incorporating a gentle and coordinator arm swing can help seniors maintaining balance and stability while walking. This is a natural motion that counterbalances the leg movement and promotes better overall movement patterns. So when we are walking, a lot of us even have sometimes improper walking techniques. So as you start working on these techniques now, it will just become a habit for later in life. But if you see that person that you take care of doing it like, short, not using arms, bending too much, you can always correct them. It will improve their balance. Assistive devices that enhance mobility. There are many different. We have walkers, we have canes, we have rollators, they have mobility scooters, and these are for depending on the needs for the person. It is very useful to have them if needed. Walkers are sturdy walkers that provide stability and support, enabling seniors to walk around safely while building a strength and confidence. These are different from rollators, which is the picture below the walkers. Rollators combine a walker stability with the convenience of wheels. So you will see these around, they have four wheels and like a seat, uh, but this is not for everybody. Most seniors want to make use of these relators, but these are not meant for everybody. So with proper assessment via therapy department, they can assign them the best device that will help them. Canes. Canes help to distribute weight and improve balance, allowing older adults to navigate their environment more independently. And mobility scooters are especially for some people that might have more mobility limitations. Um, Scooters provide an efficient and energy saving way to get around and maintain independence as well. This is not for everybody. Not everybody can make use of this. So based on different assessments, they will decide what's best for somebody. Walker and canes are the most used devices around seniors, but not everybody is actually a candidate to use them. And also, a lot of times they don't want to use them. Sometimes you might see him struggling walking around or keeping balance, but they refuse to make use of a cane or a walker because they want to keep that independence. They don't sometimes people making use of this kind of devices makes them feel like they depend too much on others, or if they are still and what they consider a young age, like 60 years old, they feel like they don't need it, and they are that's only for older people, which is wrong, you know, and that's why it's important to just keep them educated about these devices. We have modifications that we can make at home to improve their mobility, but also for fall prevention. Making a strategy home modifications can significantly enhance the mobility and independence of elderly individuals. This includes, of course, installing ramps, widening the doorways, adding grab bars, and ensuring that clutter is free, everything is clear, around the house. Well-lit environment to reduce fall risk and enable safer navigation. These are home modifications that people can make to provide a better environment for people and will help fall rate their fall prevention. Um, Yesterday we had a training of fall prevention, and this was one of the slides that we touched on. Through home modifications, we can help people move around easier and prevent a fall. So just make sure if you're a caretaker, you can always make suggestions, to family, because you have that knowledge, you are learning here that it is important for them to maybe have a ramp, widening doorways, and adding grab bars and having a clutter-free environment. If you need some assistance with that, or if you can always talk to home health if the person that you take care of is, let's say, a San Diego PACE patient. We have a great multidisciplinary team where working along with the doctor, physical therapy, social work, and home health. PACE can provide the installation of grab bars or ramps at home. So you can always, if you know that that's something that would benefit the person that you take care of or your loved one, and they are part of PACE, you can always request and they would follow up for installation and assessment of the home. And this is always to make sure that we are providing and taking care of people. Another important thing is nutrition and hydration. Proper nutrition and hydration is very important, maintaining mobility. A good and balanced diet rich in protein, vitamins, and minerals help the strength of muscle and as well as joint health. So if you keep muscle and joints healthy, it will just be mean that people will be better at moving and their balance. Things like proteins preserve muscle mass and support tissue repair. Calcium and vitamin D promotes bone health and reduces their fracture risk. The fats, the lipids, also known as omega-3, this reduces the inflammation and joint pain. And antioxidants like vitamins C and A support overall cellular health and function. So keeping a good nutrition might not sound or look like something that is related to keeping good mobility, but it is actually very related, especially in our elderly population as they become less mobile. Their muscle, if you don't work it, you lose it. So if they're not moving around, working their muscles, it just will weakens and shrink. And this will also affect joints, will uh, become a risk for falls, and falls in the elderly are the leading cause of injury, hospitalizations, and death. And this is because a lot of times they end up with a really bad injury, a really bad fracture that they have a hard time recovering from. So you can see and relate the importance of nutrition and hydration to keeping them healthy. So it is very important to eat well, and adequate hydration is also crucial, as the hydration can lead to muscle cramps, fatigue, and dizziness, increasing the risk of falls. So always encourage the elderly to drink water. Sometimes they refuse to drink a lot of water just because as people age, a lot of people have issues with incontinence or uh urine urgency, to like they keep going more or they want to go more frequently to the bathroom. And because this is tiring for a lot of people because they have issues walking around, they just avoid drinking water. But it is very important to keep them hydrated. So always promote hydration by offering a glass of water to them. We also have caregiver support and involvement. This is very important. Caring for older adults with mobility challenges can be stressful for a lot of people. And it's challenging. Caregivers have a crucial role in ensuring the elderly maintaining their independence and quality of life. This This may involve, coordinating medical appointments, arranging home modifications, and providing hands-on assistance with daily activities. So, caregivers should also encourage the elderly to stay active with gentler exercises and encouraging for physical therapy sessions. A lot of times, doctors will refer them to physical therapy evaluations, and they think that they need to do a lot of exercises, but a lot of times it's actually good for their health and they refuse to. But also having a caregiver or a family member that knows about the importance of this, it can promote and encourage them to do it, to be more active. Caregivers must also consider uh, their own well-being. That is very important, If you promote the independence of the person that you take care of, this will require them from needing more help, and this will overall help the mental health of caretakers. Taking breaks is and seeking respite care and accessing support resources can help preventing caregivers from burnout and ensures that caregivers can provide, the best possible care. So it is important to not only take care of the person, but also of ourselves as caregivers. You need to take a break if you're feeling like it's too much, and know that there are a lot of services or and benefits that you can always make use of, like respite care, um, because they can offer, other caregiver hours, more caregiving hours for the family to help them, mentally and have them give them the freedom to take care of their well-being. Um, and also collaborating with healthcare professionals and exploring community-based services can enhance their givers to support the elderly and mobility needs. As if you're a family member, you're taking care of your loved one, do not have caregiving hours may be provided. Always know that, if you're part of base, you can always talk to the different departments that we have, social services, nurses, that and express that, extern that, we have different benefits throughout PACE that will help you to get some relief and support the elderly needs of mobility. Excuse me. And by offering caregivers access to educational resources and support groups, it's very important to alleviate the physical and emotional toll of caregiving and involving caregivers in the development of mobility programs. So if you are a caregiver and the person that you're taking care of is has an appointment with physical therapy, try to take the time and actually go with them to that appointment. I hear a lot of caregivers using the excuse that they're assigned to be at home with the person. But you as a caregiver, you're the one that is spending a lot of time with them. So involving caregivers in some aspects of their care is very important. So if your client, if your patient has an appointment, it is very important that you take the time to go with them. It's part of the job as well. So because you will also learn and you can let the physical therapist know maybe how they walk, how they do these things, because a lot of times patient won't tell everything. They will try to be sneaky and not say important things or that they're doing wrong or so or on their mobility. And by you going with your client, you can also provide some feedback, and this will be on your own benefit, as well, because you will extern your concerns, um, It's not like you're gonna be making decisions for them, but also getting educated about it. So, if you see or you hear the recommendations that they're giving, you can also encourage your client, your patient to be compliant, and um, so always try to get yourself involved as your role allows you. It's not always easy, but by doing this will help not only the person but you as well, the workload. There are community resources for mobility support. We have like local senior centers, like our PACE centers, where they offer exercises classes, like support groups, transportation assistance, the help of to help elderly maintain their mobility and independence. There's aging services networks that provide information, referrals, and access to a wide range of services, including home modification, assistive technologies, and caregiver support, and also physical and occupational therapy. They assess mobility needs, recommend assistive devices, and provide especially training to help them move around safely in their environment. And these are community resources that you can find at San Diego PACE. We have all of this. We have the centers where people can go and take an exercise class there, and that will help them maintain their mobility. The services and networks, we have the clinicians that would do the referrals if they are having challenges with their mobility to trying to, find a solution for that, and access to a wide range of their services. Like I mentioned, home modifications, some of those home modifications like the installation of grab bars or um, the installation of a ramp. They can be also provided by PACE through home health and physical therapy departments. They work together for that. And caregiver support, they're always willing to try to work with caregiving agencies that will uh, help them, send more hours maybe and provide that care that that person requires. And our physical and occupational therapy department is just wonderful. They do a great job assessing people's needs, and they give out a lot of devices. If they need a cane, they have them there, right, ready there. If they need a walker, they have them there. But also, it's important to have an evaluation first to make sure that they are actually will be something that will benefit them. So we're getting to an end. And in conclusion, it's very important to prioritize mobility and ambulation and movement techniques. This is essential, and this will empower the elderly, maintaining their independence, reducing their risk for falls, and just enjoy have a higher quality of life by incorporating diverse exercises and using assistive devices when needed, as well as the customized programs for their individual needs. A senior can overcome a mobility challenge. So that's why you as a caregiver can always promote good mobility, learn about mobility techniques, and encourage them to have an evaluation. And with that, we will end up this presentation. Does anybody has a question about what we just talked today? Anything that you would like to get clarification on?